we know this is a psychological thing too, and it's very important that we address that. Now, I'm very happy to introduce you to the next speaker because I heard she had a delay. She missed a plane or anywhere. Oh, I'm sorry. I was told you were.
It was not me.
It wasn't you.
It was just Italia.
Okay. Oh, no, sure. But your name is then Maya Kirszenbaum from France, and she's going to talk to us about live your life with CF and psychosocial care. You have the floor.
Good afternoon, everyone. I'm going to try to speak not too fast because I know there is a translation going through. So if I'm going too fast, please just interrupt me. And also, I'm gonna be talking a lot. I don't have really videos, but this PowerPoint is also meant to be interactive. So please, if you have any comments, you can always just raise your hand, and I'll be very, very happy to hear you. Because I think that sharing experiences, especially in a psychosocial view, is really, really fundamental. So what you have to say is at least as much important as what I have to say. So before I start, I wanted to thank everyone for giving me the chance to be here today and to talk to you. So I'm Maya Kirszenbaum. I'm a clinical psychologist. I'm working in the CF Center in Paris in the Hôpital Necker. So before I start, I wanted to tell you a little bit more about our CF Center in France. So they were all created in 2002 with the introduction of the newborn screening, the systematic newborn screening in France. In 2012, there were about 49 CF centers, 20 were pediatrics, 15 adults, and 14 joints. And we have about 6,500 patients in France. In our CF center, we have about 200 patients. They are all in the pulmonology unit, and the youngest one is 3-day-old, and the oldest one is 25 years. This is our staff. As you can see, we have 5 doctors, 2 CF nurses, 2 physios, 1 nutritionist, 1 social worker, and 2 psychologists. But all of our CF staff is only part-time in CF. Most of the time, the other time, they're working somewhere else. So let's talk a little bit more about our psychosocial team. So the social worker, we don't have clinical social worker like in America or in England. We only have administrative, so they're dealing with papers and financial supports. We are going I'm going to talk quite fast about this concern, but if you need more information, just please let me know. So the social worker are not related to the CF center, they have their own unit. They also work with and for CF patients. The first contact they have with the patients and the family is during the newborn screening. At the second, outpatient daycare, when the question is, for example, who is going to take care of my baby, as the doctor says that he should avoid going to the kindergarten. So she will help to find finances and the allowance for a handicapped child. She also is in touch with school, as sometimes school does not want to accept a kid with CF because they are scared, or sometimes they are not allowed to give medication. So she will provide assistance to help them, to the families and the school, to be as good as possible for the education of the young child. And then when the patient is too sick to go to school, she will help with the homeschooling, and she will also provide financial support for private lessons and stuff like this. And through all life, the social worker will provide financial help for all kinds of purposes. For example, at each time CF gets worse, for example, when transplantation is arriving, she can help the family to find a better place to live, because sometimes the people are living far away from the CF center and they need to move. So she can find an apartment and help financial support to pay the new rent. Now about our psychological team. So there are 3 of us. We have 1 psychologist. She works in the pulmonology unit, and she has 20% of her time who is paid by the CF French Organization of Patients with CF and Chronic Leukodystose. So she's spending this 20% of her time essentially taking care and supporting family with newborn screening and young parents. We have also me. I'm working 50% of my time in the CF center and 50% outside of the hospital. And I'm dedicated to work with adolescents and pre-transplant and young adults. We both have shared office with doctors, so we were very scary and very worried about our condition to work with patients when we needed to have a private session. So we had the chance to be able to have a special room where we can only see our CF patient. This room is well ventilated, there are windows, and we clean the room after each session. But we have a private space where we can talk in privacy with our patients and their family. We also have a psychiatrist. He works essentially as a consultant for our CF center and for our patient, and especially I can ask him to intervene when I see that one of my patients is really depressed and might need a medication, so I need a medical advice, so I will contact him. What I wanted also to add that most of our positions in the CF centers in France, especially as a psychological positions, are founded partially or completely by those are CF French associations. So what I mean by that is that our government is not helping and not supporting hospital to offer positional psychologists in our CF center, and if each CF center can have a psychologist is also thanks to the organization of the patients' organizations. So how do we work? The newborn screening first, this is where we start. So for some historical reason, the psychologist is always there from the moment we call the parents till the moment the diagnosis is sealed. She stayed with them all the time, explaining the procedure, reassuring. And she also starting to meet the first bond and the first relationship. Then she's there the next day at the outpatient care day, and she can start to help the patients, and not the patients, sorry, the parents with the diagnosis and how to deal with this new diagnosis. Then she will see them once a month, then once every 2 months, until the kid is 3-year-old, and then it's going to be more when asked by the physician. During the hospitalization, there is a systematic consultation for the patients whenever they have time, usually in their room, and at least for 30 minutes. And then there is a support during, we also can provide support during specific medical exams. And there is a consultation for the patients and the parents, if possible, because sometimes we don't see them when the kid is during his IV courses in the hospital, and we don't see them. So when we can catch them, we gladly see them and talk about what's going on in their life. And also we can provide therapy sessions, so the patients who are not hospitalized and want to see us, because we are the psychologists of the CF and we know CF and we know a lot of things, we can also provide consultation and therapy outside of the moment of the hospitalization. So how do our patients get to see us? Usually the demands comes from the medical team, the social worker, or our nurses. Then we are also scheduled systematically in our outpatient daycare program. And sometimes the parents will ask us to see their children. Sometimes they will also ask us to see them because they have problems with the child and it's getting harder for them and they don't know what to do. And also sometimes they will ask us to see the siblings because the siblings is too often forgotten, and for them it's almost forbidden to exist because everything is about the sick kid. And sometimes the children themselves, as he knows us, he will ask to see us because something is wrong and he needs to talk to us. But this is more rare. So now let's talk about you, because I think we're here also to talk about you. But before we start, I wanted absolutely to remind you that the patient is first a person. The child with CF is first a child. an adult with CF is for an adult, and parents with sick children is first a parent, and before being even a parent is a woman and a man. And this is with whom we are going to work. We are not working with sick person, we are working with persons. And this is why, yes, I wrote that because this is often something that the patient are telling me. I am not CF, I have CF. So we keep reminding the patient that they need to exist. The CF is not only what they are, but only what they have. And so there is no specific psychological profile, as everyone is different. But for sure, there will be something induced by the disease that will make you a little bit different from the other ones. But again, each one has its own way of functioning. So why should you meet with a psychologist? Okay, I understand no one is crazy, but what you are facing is very complicated. So let's talk about it. You should see a psychologist because we are here to help you to build strategy to improve your mental health. So now you can tell me, come on, my mental health is pretty okay. Of course it is, but then we need to improve it because what you are facing every day is not easy. So I asked myself that I thought that maybe I should definitely try to explain what I meant by strategy to improve your mental health. So a strategy is a long-term plan of action designed to achieve a goal. Our goal is for you to feel good. To improve is to make something better. Your life is good, but it's complicated, but we need to find a way to make it better. And mental health is actually a state of well-being, and we need to improve also this state of well-being. So, mental health should be seen as a continuum, and it may have many different possible values. What I meant by a continuum is that sometimes you can feel depressed, and the second day you are very happy. That doesn't mean that you are really depressed. That means that you can go from depression or from feeling depressed, and after that you can feel very happy. So it's not, you are not in a category, you are moving. Therefore, the impact of the social, cultural, physical, and education can affect someone's mental health. The people who are emotionally and mentally healthy have the tool for coping with difficult situations and maintaining a positive outlook. They remain focused, flexible, and creative in bad time as well as good. So why? Because CF is a chronic disease. It is a persistent, lasting, and medical and progressive condition. The present experience will recall the past one and will involve the future as well. Physical impact will also be an impact on your well-being. When I say your well-being, is you as parents, but as well as you as patients, because the disease is here, because you're going to have needles inside you, because they're going to put you a G-tube, they're going to put you catheters, and this all may in somehow be problematic for your mental state, your well-being state. There are also psychological modification and especially a narcissistic injury. Narcissism is the way everyone is able to love himself. And sometimes when you are smaller than everyone, when you are coughing, when you cannot walk as fast as everyone, so your ability to love yourself will be a little bit injured. So we need to improve this. And you will also need to improve your self-esteem. So for this, we're going to help you to cope. Okay, cope is a very complicated word, and I will a little bit explain it a little bit later. But for now, just keep in mind that it's kind of defense mechanism that you will put set in your mind to protect yourself and keep moving. But sometimes it is too hard, and then disorder can appear, such as depression, anxiety, OCDs, which are obsessive compulsive disease, when you start to clean everything and you are so scared that there are going to be batteries and everything, that you stop inviting your friends home because this one is sick, this one this, and this one this. And this all comes probably what we think, psychologists, from the original trauma. The trauma is a damage to the psyche that occurs as a result of a severity distressing event, putting a person in a state of extreme confusion and insecurity. The trauma comes when the CF is diagnosed. The CF has a diagnosis. It can provoke a sense of powerlessness and a psychological distress. The way you resolve this trauma will most certainly be a part of your responsibility to cope with the new diagnosis. The reactivation, of course, of an unconscious, overconscious fear of death. And then after the trauma comes the grief. Dealing with CF diagnosis has been compared to the experience of grieving, as grieving of the loss of a good health for you or for your children. There are 5 stages of grief: the denial, anger, bargaining, depression, and acceptance. Those are also coping mechanisms. But you are not going through all those phases like this. Usually, you fluctuate between them and between these different stages for many years. You can go through the denial, anger, and then finally in acceptance, but then the doctor says, listen, there is a problem, there is bad bacteria in your lungs, you need an IV course, and then denial, no, that's not possible. And then anger, why, I don't understand, I did everything right. And then you start to argue, listen, maybe we can wait before the IV course, because I don't want to do it, because I'm going on vacation, because whatever. And then again, depression, you feel sad, why, I don't understand. And then finally acceptance, okay. Also by the social environment. So an individual perception and interpretation of the event is where the stress comes from. So the stress does not come from the situation itself, but from what you are going to do with it. CF is a chronic and evolutive disease, and as a chronic and evolutive disease, it is filled with variable stressor and triggers, and it triggers anxiety and depressions in patients. And the coping is the mediating variable between all life stressor and psychological adjustment. So the quality of the coping, the quality of the way you are going to deal with all the stressor in your life, and especially with CF, will influence on the way you are living with CF. Because we are here to help you to cope with, which means to help you to live with CF. So when the mental change is challenged, how are we going to help you? Who is going to help you? And what is our long-term plan of action to improve your state of well-being? We are the psychologists. The what? The psychologist, which is not a nurse, which is not a physiotherapist, because all of this, the nurses, the physio, they have a direct action on the symptoms on you. They have an action on your body. They have an action on the symptom. They have an action on demand. We don't. So what do? We have no mission of relief any specific symptoms. We have no prescription. We have not much into giving you advices. And we don't answer your questions, but we can reassure you on your normality and still not being your friends, not being in a triviality. We have another way of being there for you. So the psychologists, we need to give some sense to the reality you are going through and to help you think, because too often what is at stake is really scary. So we don't have magic tricks. We are not 911. In case of an emergency, it's very hard for us to work. This is why we need to work with you during all the time. And we need time, and especially we need good timing. So the psychological distress must be held by people who are trained for it. Because the other ones, they might give you magic tricks, they might give you advices, But then, even though it solved the solution for a moment, it will not solve it forever. The solution is inside you, and you need to find it with you. So prevention, this is how we work. It is not a therapy, but it is therapeutic. Especially in the acute moments, where we see you, and you should definitely see us. Again, the newborn screening, because during and after the sweat test, the parents are in a very traumatic state of mind, and they need to rebuild a protective shield. Also, in the outpatient clinic, following the diagnosis, to help you to deal with the trauma, to manage the daily burden. Also, during the childhood, the first IV course, the first time the doctor has to say that the patient has an IV course is a very traumatic moment. The child is crying, the parents sometimes feel guilty, what did I do wrong, we did everything we should do, why does he need an IV course, why does he need to go to the hospital? And again, the devices, every time you put a device, catheter or G-tube for the patients, we should definitely see him at this moment because we need to help him to process all these new things that are going to happen to him. And then at the adolescence, because the adolescent is the worst moment. The adolescent is looking for autonomy and he's facing puberty, and then he wants to see his friend, he don't want to do the physio and this and that. And we need to help him to build a life with CF inside. He needs to have a normal life, but in his normal life, there is CF, and he needs to take care of himself as well. And then, also, adolescence is the moment where the patients are getting more sick and more symptomatic, and it's very hard. They knew they had a disease, but it wasn't really a problem. Adolescents, this is also the part when the disease is changing. And of course, adolescents, it's the adherence problem. They're hiding the medicine, they don't want to take it in front of their friends, they prefer to go to have fun with friends instead of doing inhalation. So adherence is also something you should work. The patient should work with the psychologist. We also, of course, the acute moment are the hospitalization. I already talked about it, so I'm going to go a little bit faster on it. But I think that we should skip to the new diagnosis, as they are the sign of the CF getting more symptomatic, and they also can reactivate the original trauma, which is the trauma of the first diagnosis of the CF. So of course, you need a psychologist when the diabetes is diagnosed, when we are talking about transplant, because they remind you that at the beginning it started with, I had a child, he was pretty healthy, and suddenly CF appears in our life. At any phase where the CF is getting worse and it reactivates the original trauma of the diagnosis, you should see a psychologist. And then comes the quiet moments, where everything looks fine, there is no problems, and this is where we don't see you, this is where you don't see us, and this is probably also where we should keep in touch, because once we know each other, it's much easier to work together than just arrive, dialing 911, he's crying in my office, and then what? Arriving, seeing a patient or a parent crying in the office of the doctor, you don't know me, I don't know you, you will say I'm just crazy, I'm just crying, and then what? I just leave you. No. So this is why, actually, there is also a continuum in the way we should work with you, and you with us. So, in summary, mental health balances when facing life changes and traumas. Adjustment can take time, and there are differences between each subject. We have to hear the subject and not the patient. Is there any request from the subject? If yes, what does he really want, and what does he ask for? If everything falls into the psychotherapeutical tasks, does the chronic disease involve a chronic psychological support? I don't think so. I don't think you need a chronic and permanent psychological support. but I think that seeing a psychologist at least once a year just build a relationship, a confidence, and you know that oh, okay, I'm doing it again. And you know that the people you have in front of you knows you. You have already built a story and history with his or her, and this is how we should work. Our task is to be a witness for the patient and his family, to remember him, who he is, to help him to give a sense to what he's going through, and to be a trusty reference to help him in the way to be himself. The better we know our patient and their family, the better we can help them. I will end with a sentence that one of my patients told me. She was an adult, and we finally made the transition, and she went to the adult center. We worked a lot together, and she told me, so really, good luck with everything, and take care of yourself, because nobody can do it for yourself, even with the best will in the world. And this is why we need to work together. Thank you very much for your attention.
Thank you, Maya. Thank you. Nice. We have lots of time for questions. Anyone who wants to ask a question to Maya? You recognize things that she's been talking about? Questions?
I have a question. Okay. Am I allowed to ask questions?
Sure.
How many of you knows the psychologist in his or her CF center? Okay, question. 1, 2, 3, 4. Okay, so almost no one. So the others, you've never seen a psychologist, you don't even know that there is a psychologist in your CF center? Yes.
Maybe there isn't.
Oh, yes.
There's no, maybe she says there's no psychologist available for social work.
Okay, so in your CF centers, there is no psychologist dedicated to the CF patients. That's the reality.
I think that's a certain reality in Greece. Centers doesn't have
essential team members are missing.
Psychiatrists and infant psychiatrists in the centers. So I would like to ask a question. How you are referred to the psychiatrist? How families go and meet the psychiatrist? Yeah, but somebody said about psychiatry. That's why. Yeah, are they psychiatrists? Okay. Okay, thank you.
Any more questions from your side?
So I'm continuing to ask you questions. So for those who knows the psychologist or the psychiatrist in your center, have you ever met her or him? Have you had the chance to talk? Was he here?
Who would like to say something about that? Any of the parents that have experienced, or patients that have experienced?
Yes, in the CF center, or those who would like.
Oh, there's someone, sorry, this one first. Continue.
Γεια σας. Χρειάστηκε κάποια στιγμή όταν νοσηλευόμασταν... χρειάστηκε κάποια στιγμή που νοσηλευόμασταν μέσα στο νοσοκομείο να ζητήσουμε τον ψυχολόγο να μας μιλήσει. Για κάποια θέματα του παιδιού, γνωστά για εσάς, άγνωστα για εμάς εκείνη τη στιγμή. Από εκεί και πέρα όμως, πηγαίνοντας στο κέντρο, δεν υπάρχει ψυχολόγος που να μας βλέπει στο τρίμηνο επάνω. Θα πρέπει δηλαδή να τον ζητήσουμε εμείς. Και επειδή είμαστε από επαρχία και κάθε φορά που πηγαίνουμε, ίσως έχει φύγει και το θέμα αυτό που έχουμε συναντήσει, δεν μπορούμε να τον βρούμε και να τον πούμε για την δεδομένη στιγμή. Πάντως, έχουμε μιλήσει με ψυχολόγο, αλλά δεν υπάρχει δικός μας να το θέσω έτσι το θέμα.
There's only one person who did not understand the question, and that's me. You answered it.
There was somebody else.
But was it a remark or a question? Because now the lady who was just...
The lady said, Maya, could you explain it? What did she say?
Oh, I'm sorry. I'm sorry. Yes, of course, you don't have to. I'm sorry. So what the lady said is that when she went, she's going to a clinic, she needs to ask for a psychologist to see her daughter. So she needs to ask, and her child had the chance to see a psychologist once, but it's not systematic. So actually, when she wants, she needs to remind the doctor, or she needs to ask. Sometimes she's not living around. So when she's going to the clinic, she needs to ask for a psychologist to come to see her child. But then sometimes he's not available. So there is not one person dedicated.
Okay, there was another question. I think there was a lady there first.
There's no question. I said we make an appointment with a psychiatrist whenever we think it's necessary.
You make an appointment. That's a possibility that you have, that you can make
Once
an
every
appointment.
2 years.
I see, of course. That's a remark here.
Yes, I want to say something. I'm going to say it in Greek.
Okay.
Well, you have to use the mic anyway. You have to use the mic.
Βρισκόμαστε σε μια ελληνική πραγματικότητα που νομίζω ότι δεν την γνωρίζετε πάρα πολύ καλά. Αυτή τη στιγμή τα ελληνικά νοσοκομεία δεν έχουν τη δυνατότητα να παρέχουν ούτε περίθαλψη, αλλά ούτε και φάρμακα, πόσο μάλλον ψυχολόγους. Ναι. Οι Έλληνες γονείς, τουλάχιστον από τα χρόνια τα παλιότερα, τα δικά μας από το 1989 που ανιχνεύτηκε η νόσος, βάζουμε μια διαχωριστική γραμμή στη ζωή πριν και στη ζωή μετά. Που σημαίνει πρέπει να ξεχάσουμε τα προηγούμενα χρόνια και να ζήσουμε μια καινούργια πραγματικότητα.
Βάλτε τα ακουστικά γιατί ακούτε τη μετάφραση.
Όπου κανένας δεν μπορεί να βοηθήσει.
Okay, I'm just going to translate because I'm not sure I'm going to remember everything. So you can continue, but okay, good. Sorry. I need a coping strategy with this.
Okay.
No, it doesn't
Is
work.
there any other questions or remarks from your side now?
Yes, there is. I have a lot of questions. I'm a psychologist, so I'm asking all these questions. I was wondering. I'm a bit aware of the situation in Greece, of course, but it's not only in Greece. I mean, even in America, which the economy is really different, there is no psychologist everywhere. I mean, in France, we are really lucky because we have a lot of psychologists. We don't have a lot of time in the CF center, but at least there is a psychologist in each CF center.
Yeah,
But I
there
was
is no
wondering,
psychologist.
so, sorry?
There is nowhere psychologist here.
Yeah.
And if you have money, you can find a psychologist or a psychiatrist.
Yes.
So you have to do everything by yourself.
Yeah.
So
Yes, I understand.
we have a financial problem. You want to say something about it in the mic, please?
The adult cystic fibrosis unit in Athens has a psychologist.
Ναι, δεν έχουμε δει πολλές.
I'm sorry, I didn't hear.
The adult cystic fibrosis unit in Athens has a psychologist 3 days a week, 9 to 12. the Greek patients do not want to see the psychiatrist.
Patients don't want to see That's an interesting remark.
And if the patient is from another city except Athens?
I'm sorry, I don't know. The truth, okay, the truth is that the Greek is the
Greek patients.
Yes, they have it's complicated for them to.
They are not willing to see the psychologist because they think that it's not necessary.
Yes.
No, that's not true. That's not true.
If it's mandatory in the strategy to see the psychologist with the psychologist, the psychotherapist, the nutrition, and everyone in the same center. Because in our center we have all of them, but the psychologists are not so necessary to work together because the patients don't want to see them.
Someone wants to give a reaction to that.
Can I just answer?
Yes.
Yes, you want to react?
She wants to react.
Of course.
Θα ήθελα να ρωτήσω πόσο εύκολα ο γιατρός στο εξωτερικό θα βάλει τον ασθενή ή το περιβάλλον στη διαδικασία να έρθει σε επαφή με τον ψυχολόγο και φαντάζομαι υπάρχουν Έλληνες γιατροί εδώ πέρα και πόσο εύκολα στην Ελλάδα, αν μπορεί κάποιος γιατρός να μας απαντήσει, θα σπρώξει, να το πω έτσι, τον ασθενή. Είμαι ψυχοθεραπεύτρια, εργάζομαι σε περιβάλλον τέτοιο, ουδέποτε συνάντησα τον γιατρό να βοηθήσει τον ασθενή και να πει σε αυτό το δύσκολο σημείο που είσαι, νομίζω θα σε βοηθούσε ο ψυχολόγος. Πάμε να τον συναντήσουμε. Συνήθως λίγο υποτιμάται ο ρόλος του ψυχολόγου εδώ πέρα.
Thank you very much. I think you want to give a reaction to that?
Yes. So, first, see, I forgot. Mandatory, yes, the mandatory. So, I'm going to answer both together. So, yes, you cannot put psychology as a mandatory act. It doesn't work. But then it's a strategy that a psychologist has to build. For example, I'm working with adolescents. Most of the time we are working in the same CS center, right? I'm talking about our patients. So there are two psychologists, one for the kids, one for adolescents. Okay? Usually they bury the psychologist during the first year of the life. And when comes adolescence, so basically I'm going to the room and say, hi, I'm Maya, I'm the psychologist of the CS center. Relax. I'm not here to give you therapy. I'm not here because you are sick, because something is wrong with you, because you are crazy. No. I'm here because I define my position in knowing each adolescent of our center. And I need to know you. So who are you? How old are you? What school are you? What do you like to eat? Why you don't like to eat? Do you have friends? Not friends? And actually we are building a relation. It's not therapeutic. But it's not a therapy, but it's therapeutic. And every time they are coming, sometimes it's just once a year. Hey, last year you told me you were, I don't know, playing with the, I don't know, you are playing tennis. Are you still playing tennis? No. Why? What happened? And then, for example, they can say, listen, tennis was too hard, I couldn't breathe anymore, it was too complicated. And then we can just start to work about, oh, it was complicated for you. And then, again, we are going deeper and deeper in your relation. And then, when there is a 911 emergency call from the doctor, Maya, you have to call, he's crying, and hey, what's wrong? What happened? We know each other, so we can continue actually to work. A patient that I have never seen in my life, because the doctor says, he doesn't need, he's okay. Same call 911, Maya, you have to come, he's crying in my office. But I don't know him. Yes, but he's crying. Okay, why is he crying? Because I said that he has a diabetes. Okay, so I think it's a normal reaction. So let's let them cool down. Give them my phone so they can call me and we can talk about it when it's not so acute and so dramatically. And I don't know if it answers your question. This is why I think prevention is the way we should work with kids and adolescents, because it's also give us a spot in the family representation. It's not, no, my kid doesn't need a shrink, he's not crazy, and I am not crazy. No one is crazy. I'm a part of the team. Everyone knows you, I don't. Come on, I should know you. And to answer your question, doctors are using me, or us, actually the boss of us, the psychologists, because we are working in the progression, so they're referring, but I think it's not always like this in all the CF centers. I think it depends also because, as I told you, before being a patient, a kid is a kid, and before being a psychologist, the psychologist is a person, and it's also the way you define your work that will put you in a special position.
Can I ask you, yes. There's one, I
yes,
see one gentleman over there, and he's raising his hand for about 10 minutes now, so I'm going to give him a chance.
It's a good message question.
Sorry.
Well, I think the reason we are in this tragic place as the people think we are,
yes,
is not because the psychological patient, it's because we are not cooperating. We are always, not even in the CF, this thing, we are Greek vs Greek, always. So we don't cooperate, that's why things are so bad, that's what I think. That's what,
yes, so
not only on the psychological, not in the economics and everything, we're not cooperating. We're always Greek vs Greek.
Greek is Greek.
That's what I think. Thank you.
That's a good conclusion to this.
Araxi wanted to say something.
Are we running out of time?
Oh, okay. It's going to be the
It's funny, the whole day you have been such a quiet audience, and now... Sorry, who was that?
Araxi. She's the here.
Yeah, can we say, this lady is the last one who's going to have a question.
And I want to talk.
Sorry?
I would like to say on the comment that Greek people doesn't want to see the psychologist. I think I'm living in Belgium and working with Belgian people, but they don't want to see the psychologist neither. I mean, it's the way it is because the patients are transparent for the doctors and the whole team, and they don't want to go farther. But that's why it's important what Maya said.
That's a good remark, and I'm going to go to these people, and then we really put an end to this.
Είμαστε γονείς, είμαστε γονείς παιδιού με κυστική ίνωση και θέλουμε να κάνουμε μια ερώτηση. Πότε πιστεύετε ότι είναι η κατάλληλη ηλικία να ξεκινήσει ένα παιδί να βλέπει να έχει κάποια συναντήσεις με κάποιον ψυχολόγο? Παράδειγμα, το δικό μου το αγόρι είναι 10 χρονών. Έχουμε κάνει κάποιες συνεδρίες. Νομίζω ότι τον έχω βοηθήσει, αλλά πότε πιστεύετε εσείς ότι πρέπει να γίνει αυτό και αν πρέπει το χρονικό διάστημα να 3 μήνες, ανά 6 μήνες, παράδειγμα, η επαφή.
It's a very good question. I think everyone does not need to see a psychologist. If you feel that your kid may face some troubles, he cannot sleep well, or it's problem with food and stuff like this, at any time you can go. When you feel inside your cups, you feel that something is wrong, just go. It might be 1 session, 2 sessions, 3 sessions, it's gone. Maybe the psychologist will tell you, ooh, actually you seem very anxious, let's talk about it. Because, I mean, there is this very famous psychologist, Winnicott, he said a baby alone does not exist. A child is surrounded with a family and you come as a package. What's going on with your kid is going on also with you. So whenever you feel like going, just go. There is no right age. At one day, you can work with a child because you will work with the parents, the way the mother is holding him, the way she's looking at him. If she keeps crying and crying and crying, okay, so she cries, but she still look at him. And this is the way you work. You can work till the day 1 till the end. There is no perfect day. There is just, inside myself as a mother, I can feel that something is not good. Let's go and let's see.
Okay. I think this is a wonderful answer. I would like to thank you very much for your beautiful presentation with a very special topic.